Hepatitis A was first discovered in the early 20th century, but it was not identified as a separate form of viral hepatitis until the 1970s. Before this time, hepatitis A was grouped with other types of hepatitis, particularly hepatitis B, as infectious hepatitis, or serum hepatitis. In 1973, Dr. Stephen Finestone, Dr. Albert Kapikian, and Dr. Robert Purcell discovered the hepatitis A virus, HAV, using immune electron microscopy. This discovery allowed scientists to differentiate hepatitis A from other forms of viral hepatitis and led to a better understanding of its transmission, prevention, and treatment. The development of the hepatitis A vaccine in the 1990s further contributed to reducing the incidence of the disease worldwide. Hepatitis A is primarily transmitted through the fecal-oral route, meaning that the infection occurs when a person ingests food or water contaminated with the feces of an infected individual. This can happen in various ways, including consumption of contaminated food or water. Hepatitis A virus can be present in water sources that have been contaminated by sewage or in food handled by an infected person who did not practice proper hand hygiene. Poor sanitation and hygiene. In areas with inadequate sanitation and sewage disposal systems, the virus can easily spread through contaminated water or food. Poor personal hygiene, such as not washing hands properly after using the toilet or changing diapers, can also contribute to the spread of hepatitis A. Close personal contact. Hepatitis A can spread through close personal contact with an infected person, such as household members, sexual partners, or caregivers. Shellfish from contaminated water. Eating raw or undercooked shellfish harvested from water contaminated with hepatitis A virus can lead to infection. It is important to note that hepatitis A is not spread through casual contact, such as hugging or shaking hands, or through airborne transmission, like coughing or sneezing. Practicing good hygiene, such as washing hands regularly and properly, and getting vaccinated against hepatitis A are the most effective ways to prevent infection. Hepatitis A is a viral infection that affects the liver. The symptoms of hepatitis A infection can vary from mild to severe and may include fatigue. Feeling tired or exhausted is a common symptom of hepatitis A. Nausea and vomiting. Many people with hepatitis A experience nausea and may vomit as a result. Abdominal pain. Pain or discomfort, particularly in the upper right side of the abdomen near the liver, can be a symptom of hepatitis A. Loss of appetite. Infected individuals often lose their appetite and may have difficulty eating. Fever. A low-grade fever may be present during a hepatitis A infection. Dark urine. The urine may become dark in color due to the presence of bilirubin, a substance produced when the liver breaks down red blood cells. Clay-colored stools. Hepatitis A can cause the stool to become pale or clay-colored due to a reduced amount of bile being released from the liver. Joint pain. Some people with hepatitis A experience joint pain or discomfort. Jaundice. Yellowing of the skin and the whites of the eyes is a common symptom of hepatitis A, caused by a buildup of bilirubin in the blood. Itching. Some individuals may experience itching due to the buildup of bile salts in the skin. Symptoms usually appear 2 to 6 weeks after exposure to the virus and can last for several weeks. In some cases, people with hepatitis A may not show any symptoms, especially children under the age of 6. It is important to seek medical attention if you suspect you have been exposed to hepatitis A or are experiencing these symptoms. There is no specific antiviral treatment for hepatitis A infection. Management of the infection typically involves supportive care to alleviate symptoms and ensure the patient's comfort. Some general recommendations for treating hepatitis A include rest. Adequate rest is essential for the body to recover from the infection. Hydration. Maintaining proper hydration is important, especially if nausea and vomiting are present. Drinking plenty of fluids, such as water, clear broth, or electrolyte replacement drinks, can help prevent dehydration. Nutritious diet. Consuming a balanced diet with easily digestible foods can help provide the body with the necessary nutrients to fight the infection. Avoiding alcohol. It is crucial to avoid alcohol consumption during hepatitis A infection, as alcohol can further stress the liver and exacerbate the disease. Avoiding medications that may harm the liver. Some medications, such as acetaminophen and certain prescription drugs, can be harmful to the liver. Consult a healthcare professional before taking any medications during a hepatitis A infection. Monitoring liver function. Regular medical checkups and blood tests to monitor liver function are important to track the progress of the disease and ensure proper recovery. In most cases, the body's immune system will clear the hepatitis A virus on its own, and the liver will heal over time, usually within a few months. It is important to consult with a healthcare professional if you suspect a hepatitis A infection, as they can provide guidance on the appropriate care and monitor your recovery. Additionally, getting vaccinated against hepatitis A can help prevent future infections.